Welcome to Get Safe's Guardian podcast, which is a part of the Making Movement for Change podcast put on by Stuart Haskin and Get Safe. We have a group of panel of people today to talk to and learn about what they do and how we are all interrelated and connected. I'm going to start on the left with John and let him introduce himself and move around the table down to Mike.
Good afternoon. I'm John Suarez. I am the project manager for the healthcare and public health sector and emergency management, and also the partnership for healthcare and emergency management at the Institute for Homeland Security at Sam Houston State University.
Gareth Diefenbach, De-Escalation Training Center. I'm the director there. We're at the Law Enforcement Management Institute of Texas, which is at Sam Houston State University, and it's a COPS Office of Community-Oriented Policing Services funded center.
Hi, I'm Jeff Scholes. I'm a retired New York State Trooper. Did 25 years there, retired 2 years ago, and I was the division coordinator for our crisis negotiation program. And now in retirement, I own my own company, 886 Consulting, and I go around the country and just actually hooked up with Get Safe as their newest instructor to go around the country and talk about de-escalation, crisis intervention, and enhancing communication skills to get safer encounters with the public.
And my name is Michael Aspelin. I'm the Executive Director of the Institute for Homeland Security at Sam Houston State. My background is 26 years in law enforcement, retiring in 2014, where I went to work for the Navy as a civilian, teaching how to map and dismantle illicit networks. To include supporting our partners overseas, which was a great experience, and then came here to stand up the Institute about 2.5 years ago now.
I want to start with Gareth. Gareth, what is it that you do or what your office does and how would people know about it?
Yeah. So as I said, we're funded from the Department of Justice, Office of Community-Oriented Policing Services. So we're funded through a grant, their Safer Outcomes program. So our center is a center within the Law Enforcement Management Institute of Texas, who has the goal of the mission and legislative mandate of providing professional development training for law enforcement in Texas. And so our initiative expands beyond Texas to include this whole southeast region, and we've gone beyond that as well. So you can find us at lemitonline.org, and our mission is to expand and enhance de-escalation and crisis intervention training in the region.
All right. And the reason I started with you is because had it not been for the relationship that Get Safe has with LEMIT, we wouldn't have the relationship we have with Mike and John. Mm-hmm. So, John, how did this whole thing come about?
Well, the new course, the Healthcare Community Safety and Security course, the Micro-Learning Online, started actually at the 2023 annual conference for the International Association for Healthcare Security and Safety. I'm a member there, and they're one of our partners. Mike and I were there with some colleagues, and we kept hearing from the members that they wanted a new type of workplace violence training away from necessarily just security-centric. So that started the whole journey working with IHSS. And as we were putting this together, Mike suggested that I talk to Gareth about some of the folks that he had working with him, and he gave me 4 folks to follow up with, and we ended up choosing Get Safe as the absolute best choice for us.
It wasn't because the other 3 rejected your offers?
No, it was actually when you did that karaoke thing on the phone meeting with me. It was just captivating. I thought, this is what we need: music in the videos.
That's exactly what it was. Yeah. So, Mike, what's your role in all this?
Well, I'm fortunate enough to be the executive director and be able to say, yeah, we're going to do this. As we were walking kind of through our introductions, I started thinking through, and you asked the question, how do we get to this point where we're doing de-escalation training? I think that for those of us who have been in the law enforcement profession for a long time, you see events that happen nationally, and I think back to the Rodney King event, and that in my opinion, at least during the course of my career, was the first time a significant event happened that was nationally televised, that resulted directly in significant changes in laws regarding use of force with cops and when we were required to report it, and also changed, in my opinion. You were in for 20, I'm guessing, or something.
25, yeah. So
Okay,
I started right after Rodney King.
all right, so that'll be interesting to kind of hear his perspective on this. So when you think about what happened, and in a nutshell, what came out of it was a methodology called verbal judo. Oh, sorry. I talked with my hands. Where do you want me to start over?
Verbal judo.
So as a result of the events of that time, and changes in legislation, we saw the emergence of this thing called verbal judo, which to this day, I think is probably one of the best tools for law enforcement, or anybody for that matter. But for example, when you do a traffic stop, it always starts the same way. Good afternoon. My name is Officer Michael Aspelin with the Santa Barbara Police Department. The reason I stopped you today was for speeding. Is there any lawful reason why you were speeding today? Very, very straightforward. You give them a greeting, you tell them who you are, what agency you're from, why you're stuck. So you don't just jump into driver's license or registration, which usually results in a question of, what'd you stop me for? So from that perspective, so now being the old guys from the law enforcement background, we see these things happen and we're like, all right, well, how is this going to drive the change in the industry? And so that's where we saw this emergence of de-escalation, which I don't know about. Well, maybe you could speak to, you said that you became a cop shortly after Rodney King. So what was that?
Yeah, so I started, before I started with the state police, I worked as an investigator for a district attorney's office in New York. And I started in 94 there. And when were the Rodney King riots? That was 94, wasn't it? Yeah,
Somewhere in there.
Somewhere around then. So I noticed, that's pretty much when you first saw, as far as I can remember, the pendulum kind of swinging away from the police, right? Away from the support of the police. And because of these communication enhancing things that law enforcement did, and reconnecting with the community, and, putting communication first, always putting safety first rather, but making that emphasis on communication and a relationship and connection with the public. Over the years, what we start to see, we started to see the pendulum swing back more in favor of the police again. And it's kind of ebbed and flowed over the 3 decades since then as well. And, because of the George Floyd incident, back in 2020, we see the pendulum go back the way it was back around the King. So I'm confident and I'm hopeful that because we have so much more advanced training for law enforcement now, and that we can talk about the old verbal judo. I like to think of it as crisis communication now, to get to that outcome of de-escalation. And even if we have to use force that's objectively reasonable to get to that outcome, we're still de-escalating that situation. And all of this communication and connection is going ahead and it's making for safer encounters. It's enhancing the legitimacy of officers, the legitimacy of police departments. And I think, the more that we can do things like this and bring professionals together to talk about it, we can get that word out there to go ahead and make these connections.
Yeah, for sure. And one of the pieces that we talk about in John's program and Mike's program too is
called the IHS program.
The IHS program. John's IHS program. They in the IHS program, one of the things that came up, because for healthcare workers, right? And it's taught through the lens of a patrol cop, somebody that worked patrol with hostage negotiation backgrounds and crisis intervention and de-escalation background, because I think that law enforcement deal with more upset people than they do people that are happy, which gives them a breadth of knowledge and experience that most people never get. And that kind of training and experience translates into every industry. And although we tried to water down the law enforcement perspective, I think that we were able to drive some points home because of that training and experience that comes with being a cop. But now that we've completed the program, at least our side of it, what are you hearing on your end as far as your testers and evaluators, besides the music?
Besides the music, yeah, the music was quite the thing. No, most of them liked what was said. However, the number one thing we got back from everyone was that it needed more of a healthcare perspective. they all did comment on exactly what you just said, is that there's very law enforcement focused, law enforcement perspective centered. They wanted more of a healthcare perspective injected into it because they're not dealing with upset people in the same way that you as an officer had to do it. These are doctors, these are nurses, these are administrators, technicians, and security in the hospitals. So it's a community of practitioners that are administrative, clinicians, and others with a lot of separate roles, all revolving around one person that is in distress or in crisis, and that person's family, more than likely. So you're talking about the healthcare community, which is diverse. They've got to work together to help this one person in distress and then the family around them. So when there are things that crop up and things start getting out of hand, folks in distress start responding, it's going to be different than if you're a law enforcement person. So the tactics, if you will, are going to be similar, but not necessarily identical to that. And you can look at that because I used to have healthcare people come and train my folks at the plant. I had the emergency response teams at the chemical plants. So you can learn cross-sector. So they learned from healthcare. There's violence in the plants a fair bit. Same type of fundamentals, different environment shapes it differently.
Right. I agree. I think that there is, and Jeff and I were having this conversation on the way over here about how, regardless of the profession or the dynamic that person finds himself in, the tactics and skills and strategies that go in line with de-escalation, influence, rapport building, customer service, translate into every industry because we're dealing with the same thing in every industry, people. And
not only people, but people experiencing some of the worst things that they experience in their lives. You said it, people on their worst days sometimes. And I think as you were talking, John, that's what comes to my mind when we talk about de-escalation in different settings. It's not just that the term de-escalation. We were talking about that before we got started. De-escalation is one of those terms that everyone has a different definition for it. Nobody knows exactly what it means anymore. Some people will call it verbal judo. Some people will call it crisis intervention. De-escalation, it's de-escalation. It's non-escalation. Mike, when you were talking earlier, hi, my name is Officer Michael Aspin. You're cutting off a lot of the issues at the beginning before they could potentially crop up into a situation where it requires de-escalation. So whether it's doctors and nurses, administrators, or law enforcement, it's how do we present ourselves to people and how do we not escalate the situation? And that's half the time. That's half of the issues that ultimately crop up. If we can cut them off before they get started, de-escalation, crisis intervention becomes less important or less frequent.
I think he is exactly right on that.
I agree.
And if you allow me a couple minutes to give you an example from healthcare.
By all means.
So this last year, and I'll give you two examples without naming the hospitals. And I think I've shared this with you in the past before. I was at one large hospital at Texas Medical Center. Late at night, emergency room, and all of a sudden a patient comes flying out from the back part of the emergency room. He's trying to get his robe off, he's trying to pull hoses off and everything. He's pretty upset. And he's being chased by doctors and nurses ready to get up to this little portico. It turns out that the whole thing was that this guy had been sitting there for 6 hours. He was hurting, he was in pain, it was a job accident. But somebody made the comment that he was a mental health issue, and it just put him over the edge. Now, here's where it gets interesting. The doctors and nurses are starting to get him calmed down. About the time it starts to de-escalate, here comes security. Two big guys, fully uniformed, carrying equipment, and they come through there like Batman and Robin, and this thing just escalates immediately back up because of the way they did it. Flip side, another Texas Medical Center hospital, late at night, emergency room again. Another issue starts to happen like that. You've got folks in the emergency room throwing words around, they're threatening each other, they're starting to get pretty vulgar, nurses are backing off, and you've got patients getting a little bit weird. And all of a sudden comes in this one little guy from the security team. And I thought, gee, this guy's 20 years old maybe. He walks up to the one person and he talks so low you really can't hear. And I mean, within pretty quick, this lady is shaking her head and going, I am so sorry. You're right. I apologize. That, I am so sorry. Goes and sits, repeats it with the guy on the other side of the room, same response. So I chase this guy down in the hallway, introduce myself, tell him what I do. And I asked him, I said, man, that was great. Was that your de-escalation training? He said, no, sir, I've only been here 3 weeks. He said, that was customer service training from retail when I was in college, where everybody wants to burn the store down and kill the manager. He goes, I just treated them like customers. So you see that whole customer service aspect. And Mike makes me think of that because of the way he says he handled his traffic stops and his stops when he was a law enforcement officer. Because the way he was doing, hi, I'm Michael Lassman, I'm an officer, here's why, very polite. And because of his personality, where he tends to smile a lot and stuff like that, and put you at ease. And because he jokes, it immediately makes it a people, okay, you're a nice guy.
Well, what you left off of that is, for me, it was all about sales. I had to sell the ticket, or I had to sell you into the back of my police car.
Yeah.
And so generally I would come up with little things like, look, you were speeding, your insurance is expired, and your right taillight was out. But today's a 1 for 3 day, so I'm only gonna write you for speed. And if you just, you provide those options, it gives people an out. One thing, I wanted to circle back to the training for the hospital systems. One of the important elements of this was consistency across levels. So whether you were an executive, a manager, a supervisor, or a practitioner, doctor, or sports staff, everybody learns the same thing. So that when you're coming into the situation, you know. If you did verbal judo, if you heard the word, let's see, there's a test, we'll see if it carried over to New York. If you and I were dealing with a person and you heard me say, is there anything I can say or do at this time to gain your compliance? What was that key phrase? What did that mean?
The next thing coming is hands on.
There it is.
Absolutely.
So this is what's great.
Yeah.
2 guys from different parts of the country.
Yeah.
If we were somewhere and one of us said that, you knew that if anything out of that person's mouth was anything other than, is there anything? No, okay, you were going, and everyone knew that. So it was about signaling to everybody. That's why this is important. What I think the value add for hospitals that want to use this approach is everybody gets the same. And we had people from all different levels coming in. I want to go back to Gareth for a minute. So Gareth's background actually isn't law enforcement. It's actually serving as an executive pastor for a church in California, and he made a change in his career. So I wanted to ask, as you, and really, I don't think pastors are much different from police officers. People show up at their worst, looking for you to solve their problem in 3 minutes, and you're supposed to patch them up and move them on. So to you, Gareth, as you came into this position, you started seeing de-escalation strat. How did that align with what you had previously done? Did it make sense? Was it value? What were your thoughts on that?
Yeah, I think the way that I would describe that is based on the responses that I get from different law enforcement officials when I try to sell them that I'm doing de-escalation training. Some of them hate it. Some of them think it's the best thing ever, and some of them have no idea what I'm talking about. But at the end of the day, I guess the point that I'm making is, you said it earlier, Brad, people are people, and you're dealing with people each and every day. So whether it's a spiritual issue, whether it's an emotional issue, whether it's a disability of some kind, whether it's something you've done and it's your worst day, whatever it might be, you're dealing with people in some level of a crisis, and it goes back to customer service. How can I treat you in a way that shows that I am respectable and I'm going to treat you with respect? And at the end of the day, your goal is to solve the problem as easily and non-confrontationally as possible. So whether it's in a nonprofit setting like a church, whether it's in a customer service situation in retail, hospital, or law enforcement, it's how do I gain compliance as easily as possible? Ultimately, I mean, I think that's what I've experienced.
The common thing I think here, again, no matter which avenue we're talking about, is making a connection with somebody. We have to make a connection with that person in order to go ahead and affect a behavioral change, whether it's in sales, whether it's in
Side of a car, riding a ticket.
exactly wherever it is. You're trying to go ahead, you're influencing behavioral change. you're not going to get cooperation. You're not going to get a behavioral change from somebody who doesn't think you're sincere, doesn't think that they can talk to you, and doesn't think that they have a connection with you. Now, this doesn't mean we have to like everybody that we deal with, because let's face it, we don't.
I don't think we like
But
each other.
not at all, not at all. I want to sit over there.
Okay.
Yeah. We're not moving things
But
around.
in every situation, if we don't have that connection, we're not going to get that. So think about the relationships that you have in your personal life with the people that you like outside of our parents and our kids. How do we get that relationship? Number one, probably through some type of communication, and then through some type of connection. All right. And we can communicate all we want, but if we don't have that connection with people, we're not going to get them to think of us as sincere. We're not going to get them to like us.
And this is just a really great opportunity, because this was an organic way it brought up. That is what Get Safe does, is communication and connection equals safety.
Yep.
And that's how we build these out. If you look at customer service in the healthcare profession, in law enforcement, any industry, customer service is what keeps businesses afloat. If you have poor customer service and a great product, nobody's going to buy your stuff, because they don't want to deal with having to send it back, or they don't want to deal with like just the jerk on the phone. And in law enforcement, if you're a jerk, it's going to end up in some sort of civil suit that costs the taxpayers. So if you can build that connection quickly and effectively and efficiently through using, whatever strategies you decide to employ, like, you're going to serve your community well, whether it be in a hospital or on the street. To your point, Mike, you said the same thing about, I think George Thompson was the verbal judo guy. He did a great job of marketing his program to get it from sea to shining sea, and to where Jeff knows exactly what you're talking about when you say, is there anything I can say or do to get you to go along with the program today?
To gain your compliance.
Or to gain your compliance. That's what Gareth's trying to do, through sort of in the same way, because you have consistent amount of training companies that you use, and you push them out all over. Like, you've sent us to, I think we've been in Indiana and Kansas and Texas and Oklahoma and California. We've been all over the place. And what we're doing is we're essentially standardizing the expectation for what de-escalation looks like in law enforcement. And that's what John's trying to do with his program, is standardize what de-escalation and workplace safety looks like in the hospital system. And ideally, we're all on the same page and making those efforts from a multi-pronged approach.
Yeah, and I do de-escalation training for law enforcement and for the public sector too. And, it's basically the same steps that we're taking to get to this outcome of de-escalation, no matter where you are. The only difference is when I talk to cops, I'm talking to them about objectively reasonable force, and that's part of de-escalation too. Because if you have to use force that's objectively reasonable to gain that compliance, have you not de-escalated that situation? You have. Right? But when I talk to civilians, I'm not going to talk to them about the case law that relates back to the use of force. I'm not going to talk to them about taking measures to use reasonable force. I'm going to talk to them about when they're faced with that immediate threat, verbal de-escalation is no longer feasible. It's time for them to remove themselves from that situation. It's like for the healthcare. It's they're faced, somebody pulls out a knife, somebody has a gun, somebody picks up a chair and throws it at them. Right? They're way off of that normal functioning level. So at that point, my advice to them would be to remove themselves from that situation, which is going to be different than the law enforcement approach when we get to that point.
Yep.
But up until that point, we're talking about the same stuff. We're talking about that connection. We're talking about building relationship, and we're talking about getting people to acquiesce to what it is that we want them to do. And like you said, give them the options so that they can choose from options that are acceptable to us, allow them to save some face, allow them to go ahead and feel like they had a say in the matter.
But that's what I think is so fascinating about this topic is when we say de-escalation, most people think hostage negotiation.
Right.
And that's not the vast majority of the situations we're training people to deal with. Like you said earlier, you're trying to, I can't remember exactly the phrase you used, but you're trying to get them to gain compliance, and you're trying to win them over. You're doing sales even when you're doing a traffic stop. Can you explain why it is that you wouldn't rather just say, here's the deal, it's either this or this, and if you don't like it, you're going in handcuffs? I mean, because that's what I think most people who don't have a law enforcement background expect.
For me, it's more about entertainment, and can I convince somebody to say thank you when I give them a ticket, right? If you get it was all about the thank you, so it was more of a personal goal. But it's also your approach. What are you trying to accomplish? And I think that Jeff talked about gaining compliance. So at the end of the day, it's about how you get there is one thing. And it's funny because I could never watch the show Cops, not because of the people who were doing dumb things, but it was the way the police officers engaged, because they showed good or bad. And now in this world of cameras, everything's taped. And there are people who have, if you go on YouTube, there's people who have standing Public Records Act requests for every video taken by certain law enforcement agencies, and they post it. And so I still go and watch this stuff, and it's so irritating to see, like, you see the guys who do it perfect. And it doesn't matter how out of control somebody is. They stay consistent, even, and then you see the cops who escalate. And I'm sure there's plenty of examples that you could pull if you were teaching this class. I do want to add that, so from my perspective, coming from executive leadership and law enforcement, having finished up as an assistant police chief, my focus was always on policies and procedures. And do your policies and procedures line up with the practices that are going on in your organization? So if people aren't doing it right, is there a disconnect between procedures, and does that tie to unclear policies? The reason I say that is that in one of the courses I sat in for the de-escalation, the instructor started with, what is the source of your authority? So, which was fascinating to me, because it got the cops going right back, eventually getting to the Constitution, and then working it down. And so in some ways, if I was going to do a second iteration of this, or I was going to go live in front of healthcare, I would start the conversation as, what is your source of authority? What authority do you have over people who are within your facility? And just see where that conversation goes. I'm suspecting that you would get to, they're coming to us for care. And we have HIPAA laws, you can't throw people out of a ER, but what is that source of authority? And that actually, to me, was a great way to start, because it put officers, police officers specifically, in a mindset of, here's where I'm operating from. And I always had this phrase that I would tell cops. I would say, look, they can have the last word, you get the last act. Press hard 3 copies. They can say whatever they want. It doesn't matter. You're still leaving with a ticket, or you're going in the back of my police car. So as long as you cannot allow that, and who are they yelling at? That's the other thing too. And if I was to give a message to law enforcement, it's you got to teach the younger officers, they're yelling at the badge. They have no idea who you are. All they're doing is yelling at the badge. And so if you don't take it personal, and typically that's what happens, is it gets under their skin, or they say something, and then the cop does something dumb, and then they're in trouble. And it's maintaining that peace of mind that this isn't about me.
Well, you said they do something, or they say something, or they challenge them in some way, they question their authority in some way. And immediately, if you, as a law enforcement officer, if you don't know the answer to the question, if you've already done something that you shouldn't have done, but you're trying to get around it now, you're immediately in the wrong position, as opposed to, you said earlier, what's my job? What am I here to do? You're in sales, but at the end of the day, you're peace officer, right? I mean, the goal is to care for the public in some way and enforce the laws. And so how do we do that? It's whether it's de-escalation, whether it's non-escalation, whether it's mandatory authority, it comes down to caring for people at the end of the day.
Speaking of caring for people, John, with your hospitals that are, we cover in the course, like the percentage of overall costs when it comes to workplace violence and safety in the healthcare environment, all of that, it's in the billions of dollars nationwide, right? Whether it's workman's comp or actual issues, or I can't come to work because I'm scared to be at work, those kind of things all add up to money. And that money then translates to the consumer, because that's got to be recouped somehow. And so costs go up to be in the hospital, to get care. So do you see, one, that this program benefits the line level and the executive at the same time by empowering them to feel safe at work? Because people don't realize how unsafe they are until you point it out to them. And they're like, oh, I had no idea. And now I don't want to go over there. And it becomes like this avoidance trigger. So to the question, I guess.
So the value is both to the front line and to the executive level. There is a tremendous cost to healthcare broadly, both private and public healthcare, because of this. And of course, there's also the mandatory requirements that need to be complied with. So there's a lot of compliance that comes from the Joint Commission, the largest accrediting organization for hospitals, and CMS, the Centers for Medicare and Medicaid, which all have very strict mandates about meeting certain requirements. In fact, we've got a new Senate bill here in Texas, 240, that speaks directly to that, to all hospitals, and another one that's following 840 on that. So there is a profitability factor to it. There is a compliance factor to it. There is a safety factor to it. But at the end of the day, the Joint Commission and CMS and the hospitals all agree on the fact that the main focus needs to be on the overriding factor for healthcare, and that is for taking care of patients. And what does that do? Because workplace violence that happens here affects patients in the hospital, elsewhere as well. It's that ripple effect that goes through. And to what
John, let me jump into it real quick. So what's great about what he just said is I just talked about policy, procedure, and practice, and John just went right back to policy with the Joint Commission. So again, we go back, and which then ties back to this idea of source of authority, and how many people within the healthcare industry I'm sorry I jumped in, but I want to make the point. If you go to, at some level, maybe it's to the supervisory level, if you ask people what is the Joint Commission, they wouldn't be able to tell you. And this probably needs to be part of this kind of training, that understand what's the source of your authority. Where are you getting that from? One of the things that I tell people is, I have a master's in public administration. I had to do a assessment of my organization's Santa Barbara Police. That was my first agency, Monterey being second in California. I had to do a look at our strategic plan and our functional objectives, which could be also called strategic initiatives. The point is, I read about return of stolen and found property was one of our strategic objectives. And the light went on, because I don't know about you guys, but we got dispatched to found property calls. So you'd have to go collect the purse or the wallet or whatever it was. And if you're a go-getter, I got to do a found property call, and you grumble about it. But gosh darn it, there it was, right in your functional objectives, like, this is your job to do this. And then the light went, I was like, oh, okay. So that's why this idea of making sure from the person who's the highest position to the janitor or the gardener all understand what those organizational strategic objectives are and how they fit into the whole thing. So, John.
No, that is well put, and I hadn't thought about that, but that is exactly right on that. One of the things that the informal or formal tagline for the Partnership for Healthcare and Emergency Management is "Trust changes everything," and that's a Stephen Covey quote. But if you think about it, whether you're in sales, whether you're in the plants, whether you're in compliance or any other area, if you want compliance, if you want to make good sales, at the end of the day, somebody has to trust that you have their best interest in mind, even if that means that they're doing something or telling you something you don't like. If you buy that they're giving me a correction because they care about me and they have my best interest at heart, you'll trust them. If you believe I can trust this police officer, I'll comply. Whether you're a perp or an employee or a nurse or whatever. So the trust part of it is going to be fairly big. And maybe since words matter, I like the gaining compliance, but 40 years of private industry experience leads me more to gaining just agreement. Can we be agreed on this? And if we reach an agreement on this, we can work together. So just some thoughts on that.
Yeah, I agree about it. That goes back to making that connection, right? Selling that product, making that connection, getting that behavioral change. And along the lines of changing the words from gaining compliance, absolutely. I always like to try to bring everything down to everybody else's level. And in fact, my opening line was always, "Hey, I'm Jeff, what's going on?" That's it. No rank, no title, nothing else, because I'm trying to just go ahead and make a connection now. Sometimes that's met with a resounding expletive telling me to go do something very carnal with myself or somebody else. But more often than not, that opened the door to going ahead and making that connection with somebody. You kind of get a pause from them. So yeah, it all comes back to that human level. No matter what industry you're in, it goes back to what we said before, you're dealing with people. And people have good days, they have bad days. And like somebody said, when do we see the people in policing? On their worst day usually, right? They're not inviting us to the birthday party for the most part.
Yeah, and just to,
Which is funny. So I arrested a guy for drug possession, and about a year later, we're on foot patrol during 4th of July, and he comes up to me and he says, "Thank you, you saved my life that day. I got off drugs. Can you please come have barbecue with my family and I?" So I did get invited to
That's
to
awesome.
dinner.
That's a home run right there, right?
that's part of his
You made a
probation to
connection with that
ask you
person.
over to
Yeah, right.
eat.
You made a connection with that person and he remembered it. And that gets
Yeah,
me to
that's-
something else too. He remembered it. Because what do we do a lot of times? What do you do a lot of times in healthcare? What do you do a lot of time in sales? In policing, you're dealing with the same person again and again for whatever reason.
People want to be in the inn. They want to have somebody they want to know somebody. I don't need to have ultimate access to you, but if I know you and I know that I can trust you, you're gonna answer the questions. I was took my kid to the hospital to get a sports physical for school for this year, and it was such a nightmare because all it was a simple physical, but the doctor he comes in and we had a couple of questions, and then the nurse spent 15 minutes trying to find the doctor. We were the only ones there that day. But there was no access. So when he comes in, we're already irritated. It's like, we just had one question. You walked off before we were done. This could have been completely absolved had you just put a little bit of time and effort into making sure that our concerns were heard.
Yeah.
And that's every industry.
And luckily for you, it was a sports physical.
Yeah.
It wasn't something traumatic, right? And everybody handles their trauma differently too, right? So we talked about we're seeing people on their worst day. But is it always a crisis to us? No, it's not right?
It's never a
Because
crisis.
what crisis to you may not be a crisis to me. And it just goes back to how somebody handles that and where their breaking point is and what their coping abilities are. And a lot of times in all these situations we're talking about, unfortunately, we're encountering people who don't have good coping skills.
Well, and that brings up one of my little personal axioms is there's always more to the story. And if we're dealing with, and I was just thinking about your example of getting the physical and had the doctor, what if the doctor just had to do a death notification, which you wouldn't know? What if, he had a 6-month-old who he referred because of cancer? You don't know. And so sometimes there's always that point about, do we have the presence of mind? And believe me, I get more irritated than others. Gareth will tell you, and maybe John too. And the key here is that are we thinking about, okay, I'm getting irritated. Why am I getting irritated? Or why is this person getting irritated? And how can I help to mitigate that? One of the things we're doing with IHS is we are engaged in, and you can go to I'm going to use this as the shameless plug point. The Institute of Homeland Security is focused on critical infrastructure protection. We've got 5 primary areas: transportation, energy, chemical, water, wastewater, and healthcare. And so we're interested, not only are we interested in, so our institute's not just about providing training. This is one program of many that we offer. For those that are in leadership or executive leadership, we have a whole series of programs on critical infrastructure protection for executive leaders. It's available on our website, ihsonline.org. We're also very interested in research that helps. We're calling it applied research, or what is it that what is industry looking for that we can help answer questions to add to bottom line profitability. So please take a look at the website, and if just beyond what we're talking about today, reach out to us if you have some thoughts, some ideas, or you even want to author a paper, because we're willing to listen to proposals and share that knowledge across the industries.
Well, thank you. I think we're at that spot where we got to put up tray tables and move seats to fully upright and locked positions and land this bird. So since we started with you, John, we'll start the wind down with you. What bit of wisdom or marketing ploy would you like to add on the back end of this thing?
When you say marketing, what are you referring to?
How can people say, let's just say, for example, a hospital administrator hears this and then he's like, oh, that's what I want? How would they get in touch with you to find that?
The easiest way to get in touch with us is referring to what Mike just said. Go to our website, ihsonline.org, and when you get on there, you'll see a drop-down for partnerships. If you go to that drop-down, you'll see the Partnership for Healthcare and Emergency Management. That's where you can get a hold of me and all of us, and you'll see there that we have already got most of the major hospital systems, healthcare systems in the state of Texas are members of us. Texas Hospital Association, American Hospital Association, multitude of other associations. So reach out to me and let's talk.
Now, does this course provide any CE?
Continuing education credit,
Yeah.
CECs, yes.
Okay.
Yes.
So it may require a person to go through their organization and submit it, but generally most companies and government recognize. I mean, it's coming with a stamp of Sam Houston State University, so there's a university stamp behind it.
Got it. Gareth?
Yeah, I mean, if someone's listening to this and wants to get training like this, you can find us at lemitonline.org, LEMIT-online.org. Our program is grant funded, so it comes at no cost. We send trainers directly to a law enforcement agency. You can sign up to host a course or to attend one of our courses, and at this point, we're all over the country. And if it's not our center that can fund it, there's 9 other centers that are funded from the same initiative from the COPS office. The thing that I want to leave people with is, we said it earlier, and it's that de-escalation is one of those words that everyone has a different idea of what it means. And I think some people already have a negative association with what it could be, what it looks like. Do I want this? Do I not want this? And so at the end of the day, what we're looking to do is community-oriented policing services. We're looking to serve the public, and we're looking to serve officers and officials within law enforcement agencies as well. We're looking to make the whole situation safer. We're helping to equip officers, put a tool in your tool belt. If it's not the right time to use it, don't use it. If you need to use force, you can use force. We're not telling you not to, but we're saying, how can we help make your interactions with the public safer, more effective, and ultimately accomplish the goals you want to accomplish? So that's that's my push, is how can we help you to do your job as effectively as possible?
Right on. Jeff?
So I can be found at the Get Safe USA website, getsafeusa.com. As an instructor there with them. I also have my own website, 886consultingllc.com, and you can email me at jeff@886consultingllc.com as well. And I work with law enforcement, I work with public and private entities too, and talk about de-escalation, crisis management, safety assessments, threat assessments, behavioral observation, that kind of stuff. So thank you.
I'll start as a sociologist. When I was teaching social network analysis for the Navy, one thing we talked about was understanding who strong ties are and who weak ties are. In this case, strong ties are people you see every day. Weak ties are people you see occasionally. I just met Jeff. We're going to go our own ways, but we now have a weak tie where if I called him a month from now or 6 months from now, hey, Jeff, it's Mike Asplin from IHS. He said, hey, how's it going? And the tie is reconnected. And so when we were talking about, people just want to have a connection. They want to feel like they can reach out. We could be that in that moment. Hey, I'll be your connection. Here's how you get a hold of me, but that's all part of what we're trying to accomplish here, is to make our workplace safer, and hopefully we can do that in the healthcare context. So thanks for having us.